back to Living Dayton. We appreciate you being with us today. Officials say heroin is killing more people than car crashes. It's become an epidemic. Law enforcement and medical professionals are tackling together. Dr. Thomas McCartney is here with how you can help be part of the solution. Welcome to the show. We are so happy that you're here.
Thanks for having me.
You know, this is a problem here in the Miami Valley. It's a problem across the country. You and I were just talking before the show that just in Cincinnati last week, over 30 overdoses that police responded to in just one day. The number is staggering.
Well, even up in, in areas like Columbus and northern parts of the state, we're even seeing 4 to 5 deaths a day. So, I mean, the numbers are staggering.
So the question that I really have always been baffled by, why this influx, why this just growing number? It seems like it's getting worse as days go by.
Well, the story's a little complicated. So a lot of us believe it initially started back in the 80s and 90s when there was a huge influx of writing of prescription pain medicines. And part of that, oddly enough, is that physician satisfaction surveys were mailed out, and a lot of the tie was how happy were you with your physician based upon your pain scale. So people had a high pain rating when they left. They said that they were not satisfied with their physician's care. So the better they had their pain controlled, the better care they said they got. So there was a huge influx of writing of prescription pain meds.
And just looking at this graphic that you see right here on your screen really puts it into perspective, and really can kind of tell the story of what you had just mentioned. But the real question is, you know, with it becoming such a huge problem, what can someone do, what could a family member of someone do to really find some sort of relief, to really find, a solution?
Luckily, the medical community has realized that this is a big problem, and we're actively trying to help. There's several ways that people can seek help for heroin addiction or opiate addiction in general. The way that the clinic we run, Dayton Recovery, is something called medically assisted treatment, and we use a series of medicines to help patients come off of their opiates and stay off of their opiates. There are some people that require other care also, such as inpatient rehab and abstinence programs like NA or AA that can be geared towards them. But we found that most patients seem to be the most successful when they do a medically assisted program.
What's the first step to seeking help and going to Dayton Recovery?
So as you can see, you can call our office at any time. We always have someone available to answer the phone calls. If you are in need of getting treatment, or if your family members are in need of getting treatment, we'll schedule you with an appointment so that you can be evaluated and see if treatment is right for you, and if you need higher level of care.
And of course, you guys will work with them until the very end to make sure that they get what they need to cut it out.
Yeah, our goal is that you never go back to using opiates.
Okay, and one more time, I want to make sure that everybody is familiar with that website so they can visit it and make that first step.
DaytonRecovery.com.
DaytonRecovery.com. There you see it in Franklin, 8401 Claude Thomas Road. Dr. McCartney, it's been a pleasure having you on the show.
Thank you for having me.
Once again, killing more people than car crashes. Definitely seek help if you are dependent on heroin or you know someone who is.